Hello there once again, DangTeach at CCSD. Welcome back. Part 2 of Parenterals, our second part to Sterile Formulation. If you haven't catch the first part, if you haven't caught it, make sure you go back, watch that. So we'll continue on. We'll talk a little bit more on aseptic technique, and then we'll get into the actual practice. All right, so aseptic technique, it's everything you do together to prevent contamination. So we're going to start with the manufacturer's sterile items and manipulate them in a way that we don't contaminate them. So don't talk into the hoods to create any contamination. Airflow, so you want to use deliberate movements. You don't want to wave your hands within the hood. The first 6 inches of the hood are considered non-sterile, so make sure you work with your hands outstretched, no alligator arms. And then we'll talk about not blocking any of the critical sites. So that's the area that may cause contamination. All right, your attire. So the dirtiest thing in the clean room are the people in the clean room. So make sure you wash appropriately. So wash your hands at a hand station up to your elbows. And if there is an air dryer, that's preferred. But if you got to use towels, make sure they're clean towels. They must be sterile towels. You'll go ahead and put on your cleaning attire, and this is usually done in the anti-room, so that buffer zone before you actually get into the clean room itself. Then you'll apply on your sterile gloves. So they come pre-packaged with the cuffs folded over. So anything on the inside of the glove you can touch with your bare hands. Anything that's on the outside you can only touch with the outside of the glove. So the technique is to open up the packaging, lay the packaging out flat, and notice they're just handling the folded inside of the glove. And then with that one hand fitted, you'll slide the fingers inside the cuff. So notice there's only outside glove to outside glove contact. Then you can slide your other hand into the glove. All right. Once you have your gloves on, make sure you rinse them with that 70% alcohol and treat them as if you're a surgeon from this point on. You'll collect your supplies. You'll clean them before you introduce them into the hood. And then arrange them appropriately. Clean your critical sites. So use a new wipe each site, and you want to stroke the critical site 3 times, and that's going to be from inside to out. So you're physically removing any contaminants, any particles that might be there, and that residual alcohol, once it evaporates, it has done its antimicrobial action. The technique for inserting. So make sure you equalize pressure. So unwrap your needle and syringe within the hood, assemble them, draw back the plunger, and you want to hold it just like a pencil where you have most control. You're going to start at a 45-degree angle, and you want to have that bevel up. And this technique is to prevent coring, poking a little piece of rubber that might end up in the drug, in the IV, and into the patient. So with one motion, as you insert, you're going to move that syringe to a 90-degree angle. So it should be just one motion ending at 90 degrees. From that point, you want to invert your vial. So the easiest way is to hold the tip of the plunger, hold the bottle, and you want to rotate it just like you were driving a car. That way you don't block the critical sites. Notice the way the vial is being handled. Airflow is allowed to access the critical sites at all times. In this case, where the needle enters the vial. Remove any air bubbles. So you can do that by lightly tapping on the vial. Remove the needle from the vial, and then you can inject the drug into the additive port of the IV bag. So remember, make sure that IV set cap is there to maintain sterility. For ampules, if they're not scored, you might need to file them. If it just comes with a dot, that'll let you know where they have filed it. And if it comes with a complete band of paint, that lets you know that they filed it all the way around. So if it just has a dot, you want to point that away from you. And if it has the ring, then at any position is fine. You want to pull back on the plunger when you break it. So you want to pull back towards you. That way if there's any glass or particles that shatter, they would splash and fly away from you. So make sure you pull the ampoule neck towards you so any glass shards would fly away from you. So you're gonna get some particles, maybe some glass, paint chips that might fall in. So you'll need to use a filter needle within one of the process, whether using a filter needle to withdraw or to switch to a filter needle when you inject. Different parts of the syringe. The two areas you don't want to touch is the tip, where it allows for attachment to the needle, and the entire plunger. And that's because the plunger goes inside the barrel, and that might contaminate the drug. Notice that the tip on the oral syringe is a lot different. It will not accept a needle. And we have two types. We have a slip tip and a lure lock. So the slip tip just stays on through friction, whereas the lure lock has a screw-on mechanism. Graduation marks. So for a 1 ml tuberculin syringe, every line is 1/100th of an ml. So you can get 100 units per ml. Makes it easy to measure. For 3, every line is 0.1. For 5s and 10s, every line is 0.2. And then for the larger syringes, every line has a value of 1 ml. So make sure you read from the leading edge. The plunger will make 2 contacts to the plunger. You want to read from the uppermost ring, and don't read from the tip here. So that's a common mistake I've seen. So here they are measuring out 20, and that's the leading edge right there. Needles. You only want to handle needles by the needle cover. So there is an angled cut that makes a bevel, and remember, that's the bevel when inserting into a vial you want to maintain up. They're identified by 2 numbers. The gauge is the thickness, the bore size, and then the length, usually in inches. So the gauge and their number relationship is inverse. So the smaller the number, the larger the gauge. The larger the number, the skinnier or thinner the needle gauge. Filters. You can use an inline filter as you would for an ampule. This one is for the IV set. So the fluid will filter through the membrane before it enters into the patient, filtering out any particles that might be in the IV solution. So the IV set port, the cap will be removed and it will be spiked. So here's the drip chamber to count drips per minute. And the needle or the adapter will enter into the patient's catheter. The pharmacy will apply a flow rate to the IV bag in the units mLs per hour. The nurses will convert that to drops per minute to set the flow rate, and they'll use the clamp to change the flow rate, and then they'll count the drops within the drip chamber. And then over a minute, they can be pretty much assured of an accurate flow rate. IV piggyback. Since it's also in a bag, its verb is going to be infused. And because of gravity and its placement higher than the IV, it will flow quicker and first into the patient. Normally, the IV line will just be clamped off. So the IV piggyback can be removed, and when the next dose is due, we can reattach it. Other items, instead of gravity, we can use pumps. So this one is a CAD pump, CADD, and this one is a syringe pump. And they're commonly used for PCA, patient-controlled analgesic, because they both have secure features to them. Compatibility. So when mixing drugs to solutions, they may or may not be compatible. And the things you want to look out for are color changes, solids, smells, or any gas production. That's a sign of a chemical change. And there's a host of things that you want to make sure that are within reason. For example, protection from light. Most vitamins are colorful, so they're going to react to light. You'll need to put a cover, an amber bag over those IV solutions. QA and QC. So QA is everything you do before compounding to ensure, and then quality control is everything you do during and after to ensure that everything is done correctly. In this case, free from contaminants. So if you follow the guidance in chapter 797, they'll recommend your QA and QC programs. And lastly, some measurements to be familiar with. So molarity measures a concentration, but for physiological strengths, we usually measure that in millimoles, little m, big M. So big M means molarity, little m, big M, millimoles, 1/1000th. Number of particles, or the amount of flow of a fluid, is measured in osmoles. And again, for our purposes, we measure it in milliosmoles. Equivalents measure charges, as in the case of electrolytes. For us, we measure that in milliequivalents. Another way to express concentration is percent weight, grams per 100 mLs, because percent means per 100. So your units are just grams in mLs. And lastly, units, like as in insulin units or in heparin, right? Units of heparin or actions of antibiotics. So that might be in international units or units. All right, that concludes sterile formulations. So we have about 6 more items to load and we'll be done with phase 1. Thank you once again for joining me, and hopefully you'll stick around for phase 2, and phase 3 is gonna be live streaming inside the classroom. Hope to see you for those sessions. Have a good one.